You're on TRT to boost vitality, but your standard blood work could be missing the single most crucial safety test that protects your heart health. When you get your TRT blood work, your doctor checks your testosterone. He checks your PSA. But there is one test, more than any other, that predicts your immediate risk for a cardiovascular event on TRT. And it is the single most important safety marker that is often overlooked or misinterpreted. The name of this critical metric is hematocrit. In the next 20 minutes, we will explain everything you need to know about this one critical number, what it is, why it's so dangerous when it gets high, and exactly what to do about it. Most men focus only on their total testosterone number. They chase the upper ranges, seeking maximum vigor. But chasing high T without tracking its downstream effects is like driving a powerful sports car without checking the oil pressure. For men over 60, our bodies process these hormones differently. We often carry a higher baseline risk for heart events already. This makes managing our blood composition non-negotiable. If you are serious about optimizing your vitality and safety for the long haul, this video provides your first step. We start with the core science, why TRT naturally thickens your blood, and the specific danger zone you must avoid. Testosterone is a powerful hormone. It stimulates many systems in the body, and one of the most critical systems it affects is the production of red blood cells. Think of your bone marrow as a factory that makes red blood cells. Testosterone acts like a switch, turning that factory up to maximum capacity. This is why TRT can significantly improve energy and oxygen delivery. You have more workers carrying more oxygen, but this increase has a breaking point. Hematocrit, or HCT, is simply the measurement of how much of your total blood volume is made up of red blood cells. It's expressed as a percentage. If your blood is 45% red blood cells and 55% plasma, the liquid part, your hematocrit is 45. That is a healthy level. As TRT increases production, this percentage creeps up. When the percentage gets too high, your blood gets thick. It becomes sludgy, almost like trying to pump heavy motor oil through thin pipes. This is called polycythemia, and it is the single greatest immediate cardiovascular risk associated with TRT. Why is thick blood so dangerous, especially for older men? Thick blood forces your heart to work harder to push the sluggish volume through your veins and arteries. This raises your blood pressure. More importantly, when the blood slows down, it dramatically increases the risk of coagulation, the formation of clots. A clot in your brain causes a stroke. A clot in your coronary arteries causes a heart attack. If you're over 60, this risk profile demands vigilance. You cannot simply trust that a high HCT will feel bad. It's often silent until it's too late. So what numbers should you be targeting to ensure safety? We are setting a hard line here. The critical number to look for on your lab report is the hematocrit percentage. If you don't see it, you must request a complete blood count, or CBC panel. It's a basic lab test that includes HCT. For men not on TRT, a normal HCT range typically goes up to about 50%. But we are not aiming for normal. We are aiming for safety on the therapy. Here is the gentleman's vitality safety zone. Your hematocrit should ideally remain * below 50%. Think of 50 as your ceiling for optimal cardiovascular safety. Most clinicians agree that once HCT starts approaching 52% or higher, the risk of adverse events like blood clots significantly increases. Asterisk 54% is the hard stop danger zone. Asterisk time. If your lab report shows 54% or higher, you need to take action immediately, often before your next scheduled doctor's visit. Why the 50% rule? When you are below 50, your heart is working efficiently. When you cross 52, you enter the caution zone. This is when your doctor should already be discussing management strategies with you. If they aren't, you must bring it up. Remember, you are the CEO of your health. Your responsibility is to monitor this number religiously, particularly in the first 6 months after starting or adjusting your TRT dosage. This is when the red blood cell factory ramps up the fastest. So you've checked your labs and your hematocrit is creeping high. What are the 3 immediate and actionable steps you can take today to bring that number back into the safe zone? The solution involves hydration, movement, and a simple, proven procedure. The first step is often overlooked because it seems too simple. Knock hydration. Asterisk. Red blood cell concentration is relative to the liquid plasma volume. If you are dehydrated, your blood plasma shrinks and the HCT percentage artificially rises, even if your total red blood cell count hasn't changed much. Make sure you are consuming adequate water, not just coffee or sodas, especially the day before and the morning of your blood draw. Proper hydration can instantly drop your HCT by 1 or 2 percentage points, bringing you back into the safe zone without any medical intervention. The second strategy is consistent SNUP movement and activity. SNUP, when you remain sedentary, circulation slows, and blood volume can pool. Regular, light to moderate activity improves circulation and plasma volume maintenance. You don't need intense cardio. Simple daily walking or stretching helps significantly. Commit to 30 minutes of continuous movement every day to keep your blood flowing smoothly. But if hydration and activity don't bring your HCT down, or if you are already at that 52% caution level, the third and most definitive action is required: therapeutic phlebotomy. Asterisk. This is a highly effective, simple medical procedure. It is simply donating blood. Removing a pint of blood rapidly decreases your total red blood cell count, effectively lowering your HCT immediately. Most men whose HCT naturally runs high on TRT need to schedule this procedure every few months. Many clinics that specialize in TRT will offer this service regularly. If your clinic does not, you can often arrange it through a local blood donation center or a specialized hematology center. This procedure is your primary tool for managing HCT safely and staying on your TRT protocol without undue risk. However, sometimes therapeutic phlebotomy is too frequent, or perhaps your HCT jumps up very quickly. This points to an underlying issue with your TRT protocol itself. We need to adjust the factory settings, not just empty the tank. If your hematocrit is spiking consistently, it usually means your body is receiving too high a dose of testosterone too infrequently. Many men start with one large injection every 7 to 14 days. This protocol creates massive hormonal peaks and deep troughs. At the peak, usually a day or two after the injection, the body experiences a surge of testosterone. This powerful peak is what aggressively stimulates red blood cell production, spiking your HCT. The solution is to dramatically not increase your injection frequency. TUM. Instead of a large dose once a week, break that total dose into smaller injections administered every 3 or even 2 days. By injecting smaller amounts more frequently, you create a much more stable and consistent hormonal level in your bloodstream. Your body responds better to stability. Stable T levels minimize the dramatic stimulation of the bone marrow, often stabilizing HCT back into the safe zone without the need for frequent phlebotomy. This minor adjustment is one of the key differences between a problematic TRT protocol and a smooth, sustainable one for men over 60. Now that we've addressed the number 1 physical risk, it's important to acknowledge the number 2 fear, the prostate. While high hematocrit is an immediate safety concern, managing your prostate health on TRT is a crucial long-term strategy. Most of the information out there is based on old science. What does the modern evidence truly demand? The fear that TRT causes prostate cancer is one of the most persistent myths in men's health. This idea stems from research conducted back in the 1940s, and frankly, it is outdated science. Modern large-scale studies have shown that giving testosterone to men with low levels does not increase their risk of developing prostate cancer. The reason is simple: the saturation model. Think of the prostate cells as sponges. Once they absorb a certain amount of testosterone, they are saturated. Giving them more testosterone, even bringing your levels up from low to high normal, does not make them absorb more or grow faster. They are already full. The real risk with TRT is not that it causes cancer, but that it can accelerate the growth of a pre-existing, undiagnosed cancer. This is why pre-screening and constant monitoring are absolutely essential for men over 60. The primary monitoring tool for the prostate is the prostate-specific antigen, or PSA, test. Every man over 60 on TRT needs a baseline PSA check before starting therapy, but simply tracking the raw number is not enough for safety. The most important metric to track is your PSA velocity. Velocity means the rate of change. If your PSA goes from 1.0 to 1.5 in 5 years, that is fine. If your PSA jumps from 1.0 to 2.5 in 6 months, that sharp acceleration is a critical red flag, regardless of the raw number. It signals a rapid change in the prostate environment that requires immediate investigation by a urologist. Ensure you keep a log of all your PSA results so you can identify any sudden, sharp spikes in velocity. Beyond the hematocrit and the prostate, there is one more hormonal relationship that determines how great you actually feel on TRT. This marker is often blamed for side effects, but its management is key to sustained energy and vigor. We are talking about estradiol. Estradiol, often referred to as E2, is the primary form of estrogen in men. When testosterone enters your body, a certain percentage is naturally converted into estradiol through an enzyme called aromatase. This is completely normal and necessary. Men need estrogen for bone density, brain function, and libido. Low E2 makes you feel dry, achy, and low on energy. However, if your testosterone dose is too high, or if your body aromatizes aggressively, your estradiol levels can climb too high. High E2 causes the opposite problems: water retention, emotional sensitivity, and sometimes even the development of breast tissue. For men over 60, achieving the correct NOT-T2 ratio (DONUS*) is paramount for feeling great. The biggest mistake men make is demanding medication to crush their estrogen to near zero. This is dangerous and counterproductive. Instead, you need to find the Goldilocks zone for E2, which usually correlates with a high normal testosterone level. A healthy range for estradiol is generally between 20 and 40 picograms per milliliter, but you should aim for the number where you feel your best, with stable mood and low water retention. If your E2 is too high, the solution is usually the same as managing high hematocrit times midas more increase injection frequency, asterisk titas midas mift. Smaller, more frequent doses keep the hormonal peak lower, which means less testosterone is available at any one time for the body to convert into estrogen. This subtle protocol shift can stabilize both your HCT and your E2 simultaneously, making your TRT protocol smooth and side effect free. These three checks, hematocrit, PSA velocity, and estradiol, form the cornerstone of safe, successful TRT after 60. Now that we have established the three critical metrics, let's look at the two final, often forgotten blood markers that provide a complete picture of your overall vitality and safety. These checks ensure that the TRT itself is not stressing your core bodily functions. The first often overlooked safety marker is related to your liver and kidney function. When you receive a Comprehensive Metabolic Panel, or CMP, two key numbers appear, and AST, dolineaner. These are liver enzymes. While injectable testosterone rarely stresses the liver, it is a non-negotiable safety measure to track these enzymes, especially if you use any other supplements or medications alongside your TRT. Persistent high levels of ALT and AST indicate liver strain. If you are taking oral testosterone, which is less common but still used, tracking these levels is even more important. Keep a stable record of your CMP. You want these enzyme markers comfortably within the normal range to ensure your liver is processing everything efficiently. The second overlooked marker is your lipid profile specifically the relationship between your LDL and HDL cholesterol. There is clinical evidence that TRT, particularly when injected infrequently or used in supraphysiological doses, can negatively impact your cholesterol ratios, possibly lowering the protective HDL and raising the potentially harmful LDL. While this effect is usually mild and often outweighed by the benefits of TRT, you must monitor it. If you see a negative trend in your lipids after starting TRT, the first step is always lifestyle, strict diet adherence, especially minimizing saturated fats and sugars, and increasing aerobic exercise. If the trend continues, discuss adjusting your TRT dosage or exploring alternative delivery methods, as some protocols impact lipids less than others. By mastering these 5 checks, HCT, PSA velocity, estradiol, liver enzymes, and lipids, you move from simply receiving *TRT to actively managing an optimal and safe long-term health plan. This vigilance is the true secret to sustained vitality after 60. We've focused heavily on the mechanics of testing, but let's take 2 minutes to address the most common obstacles men over 60 face when trying to implement this protocol with their primary care doctor. What if your doctor pushes back on frequent testing? It is a common scenario. You take this detailed knowledge to your doctor and they respond with skepticism. They might say, "We only need to check your PSA once a year," or "Your hematocrit at 51 is fine, no need to worry." This is where you transition from patient to informed partner. Remember, many primary care doctors treat thousands of conditions and may not specialize in the nuanced, long-term optimization required for TRT after 60. The key is communication and firmness, backed by knowledge. If your doctor dismisses the importance of frequent HCT checks, politely state your concern about the established risk of polycythemia and clotting associated with levels above 50%. You can explicitly request the test, as it is a standard component of the CBC. If they resist adjusting your protocol for high E2 or HCT, you have the option of seeking a specialist who focuses on hormonal optimization or age management. These specialized clinics understand the need for stability through frequent injections and are proactive about safety markers. Never sacrifice safety for convenience. The goal is to feel better, nemen sef live longer, not just feel better now. One final critical takeaway on testing frequency. In the first 6 months of TRT, testing every 6 to 8 weeks is ideal. This establishes stability. Once you are stable and optimized, all 5 markers are green. You can typically move to testing every 4 to 6 months. This sustained vigilance is the cornerstone of the gentleman's vitality approach. We cut through the noise and provide actionable, science-backed information to help you live a stronger, healthier, and more vibrant life. We've covered the #1 safety risk, hematocrit, and the other 4 markers essential for prostate and overall health. If you found this information valuable and feel empowered to have a more informed conversation with your physician, please take a moment to subscribe. Subscribing ensures you never miss our expert-backed strategies, designed specifically for men mastering their health after 60. Take control of your blood work, take control of your vitality, and start living your strongest life today. We have detailed the hematocrit risk and the need for frequent protocol adjustments. Now, let's quickly summarize the optimal frequency for managing your entire panel, because consistency is your greatest ally in maintaining these 5 vital signs. For the active man over 60 on a stable TRT dose, we recommend a * full blood panel check every 4 months. This panel must include the 5 elements we discussed: the complete blood count, specifically looking at hematocrit, the PSA test and its velocity, the sensitive estradiol assay, the Comprehensive Metabolic Panel, focusing on alt-AST, and the lipid profile. Marking this recurring schedule on your calendar is just as important as scheduling your injection day. Do not wait for symptoms of high HCT or high E2 to appear. By the time you feel severe fatigue or significant water retention, your numbers have likely been out of range for a while. Remember the 3 most powerful steps you can take today. First, confirm your doctor is running the asterisk times CBC times asterisk, and not just total testosterone. Second, if your HCT is above 50, immediately asterisk nocturix doctorix 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 nocturix doctorix nocturix doctorix doctorix nocturix doctorix 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 D's increasing injection frequency. Third, keep a dedicated log of your asterisk doctorix 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 doctor. Your body can achieve incredible strength and vitality well into your 60s and beyond, but only if you manage the foundational safety parameters like an expert. This is not about guessing, it's about data-driven mastery. If you want more in-depth guides on optimizing your diet and exercise routines to support this perfect hormonal balance, explore the other videos on our channel. Maintaining this optimal state is not just about avoiding problems, it's about maximizing the benefits TRT offers. When your hematocrit is safe, your heart is happy, and oxygen delivery is optimal. When your estradiol is balanced, your energy is stable, and your mood is clear. When your PSA is steady, your long-term health is secure. Every man approaching or past 60 deserves this level of precision in their health management. Let's do a final quick review of the danger markers. If your HCT hits 54%, it is time for a phlebotomy, period. If your PSA jumps aggressively, you need a urologist review, not just a dose change. If your estradiol is pushing 45 or 50, you must adjust your injection schedule. These are the non-negotiables. Treat your body like the high-performance machine it is. You would never run a classic car on low-grade fuel, or ignore the check engine light. Your health deserves the same respect and attention. This rigorous, evidence-based approach to TRT safety is what separates men who feel marginally better from those who genuinely regain the vigor of their prime. It moves the conversation away from risky experimentation and into the realm of precise, longevity-focused medicine. Taking responsibility for these lab results is the highest form of self-care. It empowers you to partner effectively with any physician, ensuring your protocol is always tailored to your unique physiological needs after 60. We often receive questions about whether the frequency of testing or the need for phlebotomy changes as men age further into their 70s and 80s. The principles remain exactly the same, but the frequency might need slight adjustment. As you age, your metabolism may slow slightly, meaning the body might clear testosterone more slowly, potentially leading to higher hematocrit and estradiol levels over time. Therefore, maintaining that rigorous 4-month testing schedule, even when stable, becomes even more important. A minor adjustment to a dose that worked perfectly at 65 might be required at 75 to keep all markers in the green zone. Another factor unique to older men is the increased prevalence of other medications, such as blood pressure or cholesterol drugs. TRT must interact safely with all other prescriptions. This is another reason why monitoring the liver enzymes and lipids is so essential. You are ensuring that the entire chemical ecosystem of your body remains balanced. Never make a dosage adjustment to TRT or any other medication without discussing the full context with a knowledgeable doctor. Use the data we have provided today not to self-diagnose, but to guide a highly informed consultation. You are bringing the expertise of precise monitoring to your physician's broader experience. This meticulous approach is simply the cost of admission for maximizing your health and longevity. It is the definitive resource for men serious about living a vibrant life. We have delivered the safety knowledge. Now it is time for you to take action.